Joining us now is Shelley Archambault, board member of Verizon, Okta, and Nordstrom, and the former CEO of Metric Stream. Shelley, we had, just before we get into the meat of things, we had a discussion earlier. Do you think that number is just pulled out of thin air? Do you think they have any idea actuarially what they need to cover as a company for healthcare because of COVID for their employees? You think it's exactly $200 a month for unvaccinated employees?
Honestly, I can't tell you what Delta Airlines knows or doesn't know. I know all companies are looking at what their overall expenses are and what things cost, but I have no idea what went into the decision around $200.
I've got, as you can imagine, in the social media world, there's a lot of people saying if you do the math on hospitalizations and it becomes serious, 0.0 this and that there's no way that's a real number. Does it matter whether that's the actual number or not? Or can they just pull one out of thin air and say, hey, we're the company, you're either paying this or you're not going to work here?
Companies can decide what they're going to charge and how they're going to charge for different healthcare. If you look company to company, the premiums employees pay differ across companies. So each company decides what works for them and what doesn't. So can't comment on what they charge. When you ask, does it matter? It comes down to what behavior they're actually trying to drive. So it's really the concept of what they're doing more so than the actual dollar amount.
Why do you think they're hesitant to say, if you're coming in physically to the office, you can't come in unless you have the vaccine? Is there future liabilities, some type of lawsuits? What's the problem with just, going full on with what they tell employees to do? Why half measures?
We are in unprecedented times. Every single company is trying to figure out how do they thread a very fine needle. They're trying to create an environment that's safe for their workers and their suppliers as well as their customers. At the same time, they need a workplace that will be efficient and productive, and they want to make sure they're also following different rules and laws and regulatory environments, which, by the way, are changing. States are coming up every day with new requirements of what you can do and what you can't do. So every company situation is very different. Some companies have situations which people have to work together and have to be close in proximity. Others, you don't. You can be remote. So therefore, what my rules are and what my policies are will be different. This is very unique to every single company.
We've always had the discussion, not on all cable channels, I guess, but on some that there was a balance, saving lives and saving livelihoods in what we're both trying to do. At this point, if vaccinated people can have breakthrough cases of COVID, and if they can transmit COVID to either vaccinated or unvaccinated people, and we say this again and again, that then bring it home to their children and get, how, at this point, don't we need to have double vaxxed, double masks, social distancing? We're back to square one. If we try to get COVID cases to zero, instead of the other 200 human transmissible infection, whatever you want to call it, diseases that we have now, there are people that say this is going to be added to that. There will be 201 because COVID's going to be around. It's never going to go to zero. So if there are vaccine breakthroughs, do we need to go back to masking indoors, masking outdoors, masking children in school, requiring double vaxes, work at home? You see what I'm saying? What is enough? When is it enough? What do we do?
The issue here with vaccinated, unvaccinated is if you're vaccinated, and the CDC has said, healthcare professionals have said, that if you're vaccinated, can you get COVID-19 or get the Delta variant? You can, but the level at which you will be ill is significantly different. The public policy issue here is overwhelming our hospitals. So we want to make sure if everybody's vaccinated, then yes, I might get it, but the odds show that I won't be hospitalized.